Okay, I am absolutely delighted to be able to introduce our featured speaker. If you could imagine a professor's dream come true, then you are prepared for Amrita. Amrita Bahl is someone who came to Teachers College and received her master's degree, even as she came from India with a master's degree in clinical psychology. And she took what was the assignment that I've been giving students for about a decade, and she turned it into a vision and a project, and created the logo, and came and showed me the logo, and talked about how she'd met someone who might help her with funding, graduated, and lo and behold, created a model demonstration product in India, in a female prison and in a male prison, that is a model for all of us to consider in all of our particular countries. As a matter of fact, one of the main reasons why I wanted the Minister of Health of Ghana to be here is because I was hoping that he would see the promise of doing this model in all the prisons in Ghana. So it's great that we're videotaping this, so I will direct to the Minister of Health that this is the vision, this is what's possible in Ghana, and for those of you who are working in other countries around the globe, this is what's possible in all of those places too. So she's going to show you the final product, and we're going to, in my talk, which will be rather short, I'll talk about how we're also making this information for other models of peer education globally available. Without further ado, I introduce to you a professor's dream come true, the one with passion and commitment and vision and the willingness to work hard, Amrita Bahl.
Thank you very much for that glowing introduction, Professor Wallace. Thank you so much. It's in fact a huge honor for me to be able to share my work with you here today, and thank you so much for allowing me to do that. I am going to begin by telling you a story, and this story of passion and commitment involves two media, so bear with me if I'm fumbling with my technology here. I'm going to be showing you a film, and I'm going to be using my PowerPoint slides as well. Okay, so before I begin to tell you this story, I want to give you a brief background. It's going to sound like a history lesson, but it isn't. I hope it isn't for you. This is a story about attitudes, how we changed attitudes in India. And what I would like you to do is travel back with me in time to ancient India, the land of mysticism, snake charmers, and yogis. It's about 4th century AD, between 4th and 5th century. And the great learned philosopher Vatsyayana has just finished writing the Kama Sutra. Have you all heard about the Kama Sutra?
Oh yeah.
Oh yeah, I got an oh yeah right here. But for those of you who have not heard about it, it is this ancient Indian text on love, sex, lust, of course, and also human sexual behavior. And Vatsyayana did not have to deal with censorship back then. So, you know, he pulled all the stops. He wrote such graphic details about how you can pleasure yourself and how your body can be like a house of pleasure. Okay? Now, let's fast forward at warp speed to the year 2005. I have very little time to share everything with you, so we're forwarding. And so we've gone over some 2,000 years already. Okay? During this time, India has been invaded by different nations. Indian culture has been influenced by their culture. So what you see is modern day India, a growing superpower, as we would like to believe, with a booming economy, but with one problem. We don't talk about sex. The land that gave you Kama Sutra does not want to talk about sex. It's taboo. We just don't mention it. And what's happened as a result of this? We have 2.47 million people who are HIV positive. And one of the primary routes of transmission is sex. It's through the sexual route. So, you know, this is a problem. And because of this lack of it's been fueled by this lack of communication that we have. Okay. 1 second. Just give me 1 second. Just move my other slide. Sorry. Okay. So, before I get to this slide, actually, let me tell you that when I went back in 2005, this was the environment that I was working in. I had to deal with people, with bureaucrats who did not want to talk about HIV as openly as I would like to talk about it. When I talked about masturbation, I was looked upon, and I'm a girl, and as a girl, as a woman, it was more difficult for me to go and talk to men about it. So anyhow, we went ahead, like Professor Wallace told you, I designed this peer-led health education program, and I went back to India to implement it, and we talked, the focus of this program was HIV/AIDS prevention, but it was disguised under this garb of a overall peer health education program. Because I did not want to face too much opposition to talk about it, and also because there are other diseases that we needed to talk about. For example, tuberculosis is endemic in our country. We need to talk about these issues. So it was then that we started SEHAT, and we talked about different modules. We even talked about life skills training, etc. People ask me, why did I choose prisons as an option? Well, first of all, they are one of the most neglected and marginalized people, and they're extremely vulnerable. Why? Because we have severe overcrowding in our prisons. If you look at figures, for example, let me talk to you about the Tihar prisons. It is the pilot site for our program. It was built to house only 5,000 prisoners. It's currently housing 13,000 prisoners. So you can imagine the proximal distances the lack of it in our prison. And also because I want to talk about, the prison is a place where the 3 high-risk populations are going to be present at some point. These are the female sex workers, which is, by the way, sex work is illegal in India, as is drug use. And, long-distance truck drivers are not immune to committing crimes. So at some point, these 3 high-risk populations are rotating in our prison, and I wanted to be able to reach out to them as well. And also because of, we have so many people who are awaiting trial. The Indian judicial system is very faulty. People have to languish in our jails for nearly 5-6 years before they get the first hearing. So here are people who are waiting for their turn, and we can teach them things, different things, and we can train them for future employment. One of my key visions is to create this parallel health force, which community health workers who can work in partnership with the government. So that is one of the key reasons why I wanted to work in prisons. I'm going to share the film with you now, and we'll just take it from there then. Thank you. It's happening. It's happening. Don't worry, Sonali. That's just, tech issues. Okay. Yeah, I think we got it.
Okay, it's loading.
It's loading? Okay. This film was made by a gentleman called Rusbe Nari Barucha. He was, it's very difficult to get into our prisons. We have to take permission at the ministry level. So it was tough, but we managed to get him on board to come in and shoot a few sequences for you all to see about what's happening in one of the prisons in India. The project is being piloted at 2 sites. One is Tihar, and the other is Amritsar prison.
most happiest day in my life.
मेरी 1.5 साल की जो मेहनत थी आज वो रंग लाई।
मुझे यकीन नहीं हो रहा है कि मैं आज इतनी मतलब मुझे सर्टिफिकेट मिला है और मैं इतना कर सकती हूँ।
मेरे पेरेंट्स के साथ होते मेरे को अच्छा लगता, लेकिन आज कोई नहीं मेरे पास। मैं जेल में हूँ, फिर भी मेरे को बहुत अच्छा लगा। सेहत में आके मेरे को बहुत अच्छा लगा। सेहत जैसे प्रोजेक्ट ऐसे होना चाहिए और मैं दिन रात इसके पास बहुत मेहनत किया।
सेहत से जुड़ के, अमृता दीदी से, किरण मैडम से जुड़ के मैंने बहुत कुछ सीखा जो मैंने अपनी ज़िंदगी में पिछले 24 साल में नहीं सीखा, वो मैंने सेहत में जुड़ के 1.5 साल में सीख लिया।
जेल में आने के बाद इंडिया विजन फाउंडेशन से अमृता जी और मेधा जी उनसे मुलाकात हुई और मुझे पता चला कि ऐसी कोई बीमारी है, ऐसे कोई प्रोजेक्ट है जहाँ पर हम काम कर सकते हैं और समाज के लिए हम कुछ कर सकते हैं। इसलिए मैं जुड़ी और आज 1 साल हो गया पूरे और मुझे सर्टिफिकेट मिला है।
इट्स अ वेरी यूजफुल प्रोग्राम इवन फॉर अस एंड फॉर द सोसाइटी ऑल्सो।
बीमारी के बारे में बताया, किससे क्या फैलता है, मुझे सब कुछ मालूम हो गया।
In between, I was thinking I'll drop out. I was thinking I'll just because more than teaching the modules, the most important thing is building relationships.
The full form is Social Education and Health Advocacy Training, and it's an acronym, SEHAT, which means health. SEHAT started in May 2006 in SEHAT and April 2006 in Amritsar. We as an India Vision Foundation and Project SEHAT, we were looking for funding and the UN was looking for an implementing partner. We have permission for the adolescent prison, which is jail number 5, and we have permission for jail number 6, which is the women's prison.
मैं सेहत प्रोग्राम को बहुत दिन से वर्ष करते आ रही थी। देखिए कि इस जेल में ऐसा प्रयास कहाँ से शुरू हो गया जो होना संभव ही नहीं है।
सुना था कि HIV है, ये कॉन्डम लगा के करो, बस इतना ही सुना था। कैसे फैलता क्या है, मैंने भी हाथ को लिखवा लिया, टैटू बनवा लिया, उससे भी फैल जाता है। यही आके पता लगा मेरे को।
Because HIV does not have a cure yet, it is imperative that we believe in prevention methods.
We know that almost 1/3 of the prison population is coming out of addiction issues. Crime and drug abuse, crime and alcoholism, crime and promiscuity, all these are very, very heavily interlinked. And HIV is a byproduct of all this.
Currently, the population of prisoners in India is more than 358,000. And therefore, I feel the need to go to different prisons because, this is a sitting population. We can optimally train them.
This is the first experience for me also interacting with NGOs, and I'm very happy and satisfied with their work because there are a lot of NGOs in jail working at prisons, but this is the first NGO who is involved in medical staff as well. When I started my peer group, they didn't know the full form of SEHAT, so they used to call the class like a condom class, HIV class.
Peer-led health education programs are very important. Simply me going and teaching is not of enough value because the peer is a very credible source of information. You would talk to your friend and you'd probably listen to him more than if someone who's 20 years older to you will try and tell you something, right? So that is why I felt the need for a peer-led program as well. And they talk about key infectious diseases.
काफ़ी बंदे हमसे आके पूछते हैं, भाई मैंने वहाँ सेक्स करा था, बगैर कॉन्डम करा था, ऐसा तो कुछ नहीं। तो हम उन्हें समझाते हैं कि देख भाई, सेक्स करने से कोई बुराई नहीं है, लेकिन बात यह है अगर तुम्हारा जो पार्टनर है, सेक्स पार्टनर, अगर वो HIV ग्रस्त है तो तुम्हें भी हो सकता है बगैर कॉन्डम भी। अगर वो नहीं है तो कोई दिक्कत नहीं, लेकिन हमेशा सावधानी ये बरतो कि जब भी करो कॉन्डम लगा के करो। तुम्हें ऐसा क्या करना है? और आप जो
current set of peer leaders, I have inmates who have never studied before, who are completely illiterate. I mean, they have been so challenged by this project that they have actually gone on to learn Hindi, to read and write.
जब मैं जेल आई थी तो मैं पढ़ी लिखी नहीं थी पहले, ना मुझे कुछ भी नहीं आता था। फिर सेहत क्लास में मेघा दीदी आई, उन्होंने हमें बहुत कुछ बताया जो कि हमें बिल्कुल पता नहीं था। टीबी क्या होता है, HIV क्या होता है, इसके बारे में सुना ही नहीं था हमने, HIV क्या होता है। फिर दीदी ने हमें पढ़ाया तो अपना भी मतलब पढ़ना लिखना सीख गई मैं और उसके सेहत से मुझे बहुत फ़ायदा हुआ।
What we did was then we partnered one literate person, a fairly literate person, with a less literate person. You know, so Amina partnered up with a girl called Sonia. Sushila partnered up with a girl called Nurran. You know, so they benefited by learning a few more things. At the same time, they have a position of responsibility. We wanted the program to be a participatory program, less of a lecture method, because you know, according to principles of adult learning, you cannot just lecture people and expect them to retain it. So it's more important for adults to play and to perform activities to retain what they have learned. I think what has really worked is the fact that we've had some fun games also, like tug of war. We've used tug of war to explain how infections happen. Theme-based snakes and ladder. We have devised a game of flashcards. Flashcards where we're going to use this to show an HIV transmission, how HIV transmission occurs, what are the methods. We've used innovative games to explain the human immune system. It was such a challenge. That module was a huge challenge for us. We have theme-based songs. Sham in jail number 5 wrote a song based on the theme of Suno Gaur Se Dunya Walo.
कैसे कैसे समझाऊं मैं तुम सबको ये यारा ड्रग्स बिना तुम छोड़ो मेरे यारा.
To celebrate the International Day Against Drug Abuse and Illicit Trafficking, we organized this program in CJ5, the male prison in Delhi, and we had this huge puppet show over there, which was a big success. These were the things that we used: role plays, dramas, puppets. I'm also planning a magic show now, so that's my next step. But these were the things that we used to teach them and make things more interesting for them.
We have conducted a lot of demonstrations also. My doctors have taken a lot of classes, and whenever they invite us, we are always there to help them.
I think the most important thing that we've achieved so far, and really it's taken us a whole full 1 year, 365 days, to bring this turnaround in the prison authorities to allow us to do condom demonstrations. So I'm doing condom demonstrations, male and female, so that both people know how to use preventive methodology. We're talking about other contraceptives as well. According to Section 377, homosexuality is illegal. So we really cannot distribute condoms. However, a plus point is the fact that we're now talking to the authorities and they're saying, okay, when they're going to be released, maybe at that point you can hand them condoms. In the male prison, same-sex behavior is very rampant. For that, what we are trying to do at this point of time is to make sure that we tell them the risks involved. Even if they do continue with it, we want to tell them preventive methodology with existing resources. They have alternatives. Oral sex, they have alternatives. Masturbation, they can engage in all these things. So these are things that we could not talk about a year ago. You know, now my boys can confidently talk to me about it. It wasn't happening earlier.
You know, these HIV is something like people are very scared of it, yeah? And whenever they come to know that they are suffering from this disease, it is a very emotional shock for them.
डर था बहुत, इसी मारे मैंने नहीं करवाया.
इंसान 6 महीने से लेकर 20 साल तक जीता है और हो सकता है इसमें एक इंसान घबराहट के कारण जल्दी इसकी मृत्यु हो जाए और इसको इंसान को घुट-घुट के जीना पड़ता है, तो इसीलिए लोग कराते नहीं है.
घर वालों को तो पहाड़ है रेप बीमारी. मुझे पता ना, छूने से नहीं फैलती, खाना खाने से नहीं फैलती, साथ रहने से नहीं फैलती, पर घर वालों को ऐसा नहीं पता. घर वाले तो छुआ-छूत की बीमारी ही मानते हैं. तो इसलिए अगर उन्हें पता लगेगा क्या उनके दिल में बीतेगी, मेरे लिए प्यार प्रेम रहे ना रहे.
I think what this program has done, it is not just taking them away from HIV issues, but instilled into them a sense of responsible citizenship. It's talking about total health. It's talking about good health. It's talking of personal restraint. It's talking about responsible behavior.
4 of my boys who got released have gone to the respective villages, have done a sense check of what needs to be covered over there, and have started meeting up with me now. It's a post-release network that we've set up,
and they're telling me that they want to start SEHAT in their respective villages. They want to go to colleges and schools there to start talking. So, and there is no financial incentive involved for them. So that means we have achieved some degree of success with that.
मैं बाहर जाऊँगा, बाहर जाकर अपने घर वालों को राय दूँगा, जो पढ़ा है पहले तो वो बताऊँगा घर वालों को कि ये जो मैंने सीखा जेल में जाके, वहाँ पे मैडम मिली, उनसे काफ़ी अच्छी मुझे मॉडल मिली, और अपने पड़ोसियों को भी बताऊँगा।
सारी जिंदगी पर मैं नशा, HIV, AIDS, सब कुछ के साथ में काम
I will teach to my children, I will teach to my friends, all my families, I will teach them all what I have learned in program.
और मेरी दिली ख्वाहिश है कि जो मैंने सीखा वो सभी सीखें, चाहे वो जेल में हो चाहे बाहर हो, वो सब जगह सीखें।
मैं जब तक मतलब दिल्ली में रहूँगी तब तक मैं सेहत के साथ काम करना चाहूँगी, आगे भी पढ़ाना चाहूँगी। अगर मैं गांव चली गई तो गांव में भी अपने लोग मतलब जो वहाँ पे हैं उनको भी ये जानकारी देना चाहूँगी।
I think the success of SEHAT project in Tihar may act as an incentive, and it may move the headquarters in Vienna to say, stay on with this project and take it to other prisons also. Don't walk away so soon because it's replicable. The United Nations needs to pump in more money. I think they need to stay with the project, develop training material, modules, trainers programs, and then find the funds, at least to go to the capital cities.
If the United Nations were to withdraw funding at this point, we will have to greatly scale down. My girls will feel so bad. They will feel so helpless if we don't continue.
मैं चाहती हूँ कि और भी लोगों को पता चलेंगे, जो कि किसी को पता नहीं है, बहुत लोगों जो पढ़े लिखे नहीं है, उनको बिल्कुल भी नहीं जानकारी इसके बारे में, और जो जेल में भी है, बाहर जो है, उन सबको मालूम होना चाहिए। लेकिन ये बीमारी बहुत खतरनाक है, उससे हमें सबको बचना चाहिए, क्योंकि हमें भगवान ने जिंदगी दी है, उसको हमें जीना अच्छी तरह चाहिए।
Thank you. Thank you. We have some visitors from India. They just flew in last night. I would like you to meet Chaudhry Charan Singh. Chaudhry, namaste karo sabko. Namaste, namaste, namaste. And his wife, Sunehri. Sunehri, namaste karo.
Namaste, Dr. Wallace.
Namaste, Dr. Wallace. See, Dr. Wallace, you're so famous. They already know you in India. Okay, 1 second. Okay, so I'm going to just give you, before I give you an update on what's happening in India, I just want to share with you that we're one of the first NGOs to do a condom demonstration in an Indian prison. And we're also one of the first NGOs to do a voluntary HIV testing camp in the prison. Of the 75 people that we tested, only 1 turned out to be positive. So I'm not sure, I mean, we don't want to force anyone to come forward and test. And as you can see, there was this one boy, one of my leaders, he chose not to get tested despite the counseling, and we did not want to force anyone. So, that's just something that I wanted to share with you. Okay, so I'm going to give you a quick update on what's happening. And acha Sunehri, batati hu. Okay, she's just telling me what's the latest. Since she's just flown in last night, she just wants to let me know what's the latest, what's happening. So here's some stuff that we put together. Thank you, Sunehri. Bahut shukriya aapka. Okay. So 50 peer leaders have been trained so far under the program, and these leaders have gone on to extend their peer groups in different wards. The setup in the prison is that each prison has different wards, and I was allowed access to only 1 ward as the pilot, for the pilot. So now the boys can go to different wards, and that's what they're doing. They're educating people about what they've learned, and they're using the SEHAT Natak Mandali, which means it's like a rangmanch or like a troupe of puppeteers and actors. So they're traveling within this prison and spreading the word. And I'm hoping that they get permission to travel to the different prisons within the complex of this large Tihar prison. Okay, and the peer leaders who've been released, in fact, one of them who was singing, that guy, his name is Sham, and we invited him to our annual day function, and he sang in front of like some 700 odd people. It was such a wonderful experience for him, and you know, it's just amazing how he's connected with us after that. He's, you know, I think we got a lot of credibility with them because we promised them things that we did them. That's very important. You know, in prison, you need to, if you commit to something, you have to deliver. Please don't make false promises or commitments if you cannot deliver. Okay, and yeah, so my other released peer leaders are now being involved in community training sessions. In fact, Soneri was, you know, one of the updates that she just gave me was that they were just recently invited to perform in this slum community on the outskirts of Delhi about HIV/AIDS prevention. So she was super excited about it. Thank you, Soneri. Thank you. Okay, so I'm going to quickly tell you what worked for us. Partnerships, very important. You cannot work without partners. There's only so much that you can do on your own. Okay, so why not use people who are doing work already and existing resources? That was one of the key strengths of our program. We involved not only just the prison staff, we talked to the family members. We involved them. In fact, twice a month, the chairperson of the foundation, who's a very senior police leader, very senior police official in Delhi, in India in fact, meets with our peer leaders' family and talks to them, and you know, listens to their grievances against the law, and you know, we try and do whatever we can. We try and facilitate. We have home visits for our peer leaders. I've not extended that to every member of the group, every peer in the training program, simply because we don't have the resources to do it. And we even partnered with other NGOs, like the Voluntary HIV Testing. I didn't have the resources. I just went and spoke to a partner NGO, like to an NGO, and they said, yeah, we'll do it for free. I was like, yay, free, that sounds good to me. Okay, and you know, the one thing that we didn't do was to create parallel structures, and by that I mean, you know, our government has the political will to do stuff, and they have the resources. They just lack implementation skills. So for example, my jail already had medical staff. So why should I involve people from outside to come in when I can, you know, talk to them and make them a part of this entire project? So we did not go about setting up or, you know, holding special sessions of testing or anything. For every medical concern, we would direct them to the existing center, and you know, you use the help of the senior medical officer over there. You know how this helped us? It helped us break down all the walls that we had. There was like this very clear divide. You know, they didn't trust me. The prisoners did not trust me when I walked in. You know, they said, we'll see. We'll see how this goes. You know, now they tell me, you know, Didi, we thought that you're just going to be one of those many who comes in, does her work, and gets out. I'm like, okay, thank you. So now, like I said, they are my girls and my boys. I'm a part of their lives. You know, they've influenced my lives. They've taught me so much. They've taught me patience. They've taught me how to overcome certain obstacles, and I had quite a few of them. And they taught me a lot of other things that I don't want to share right now with you. So it helped me build bridges, basically, you know, with the officials. You know, I'm sure all of you know that India is, I wouldn't say a very corrupt nation, but there's corruption. So what works? I don't have the resources. I can't grease palms. So what works for me is, you know, making sure that we work with the jail officials, not against them. Okay, that is very important. Why would you like it if I come and tell you, you're doing this wrong? No. You'll say, who the hell are you to tell me you're doing this wrong? So, you know, there's a way to work around it. You go, you know, you say, okay, thank you so much. You know, I understand where you're coming from, but, you know, how about if we do it this way? How about if we do it this way? No buts. You know, just a suggestion. And it worked. The next important thing, being flexible. When I went to India, I had this set timeline and a research protocol. It all went flying out of the window. My needs assessment was supposed to take 3 months. It took me just 3 months to get permission to get into the prison. My peer training was supposed to take another 3 months. It took me 1 year to train everyone. So please be very flexible in your approach. And the most important thing that worked for us, my personal mantra, it's always possible. There is no such thing that you cannot do. If you set your mind to doing it, you can do it. There's no two ways about it. Thank you, ladies and gentlemen.
The preceding program was brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.